Hello, this is Dr. Kavian Milani for Virginia Medical Updates. One of the major issues that we are dealing with nowadays with regards to children and adolescents is the issue of obesity. The children that have become overweight due to excess calorie intake, lack of playtime, and increasing screen time. As we all know, the kids are on screen time a lot. People do seem to be okay with that. The kids are on different media, on phones, Snapchat, other media, Instagram, and with all that that's going on, basically there is decreased time for children to have physical activity and to exercise. Also, worsening the problem is that there is an increased caloric intake at all times. So children seem to be eating more and more unhealthy foods and more processed foods, and there is definitely a decrease at this time in the intake of fruits and greens and vegetables. For the most part, also children are having decreased time devoted to energy, exercise, outdoor activity. So with all this, for some time, doctors have been recommending for the pediatric population, ages 2 to 3 all the way to 18, for a BMI evaluation, lifestyle modification, parental counseling, motivational counseling with children in that age group. There are a total of 12 studies, 10 randomized trials, and 2 basic case series. And when you put all these numbers together, it looks like this across the board, there is not really a very effective way to make a meaningful intervention, to have children lose weight, have more exercise, and to change parental attitude towards screen time and towards weight loss, serial BMI measurements, counseling, the following of BMI, motivational interviews. None of this stuff has actually worked, which is really upsetting because a lot of our time as a clinician is spent doing these things. So I think that far from being passive about this and having a defeatist or disappointed attitude, the most important thing for parents and for physicians is to recognize that the short visits with doctors on this particular issue may not help. And potentially they need to be seen in clinics or by experts that have had more focus on weight management and health parameters for children and adolescents. Then, of course, the concerted effort has been made to decrease screen time and to increase outdoor activity and playtime. Now, in a place like Northern Virginia, some children obviously are extremely involved in physical activity, soccer, football, volleyball, baseball, and track and field, swimming. These are activities that burn a lot of calories and are really very, very healthy and very good. And the rest of the time, the children are basically studying or working towards some of their academics. And so naturally, there is an improvement in these health parameters. However, for the vast majority of children, that's not the case. The kids are on Snapchat, on their phones, texting, group texting, chatting with colleagues, friends, schoolmates, classmates, and on Instagram and like. So therefore, we really need to have a real serious heart-to-heart discussion with parents and begin to decrease this particular phenomenon. It has to be by the doctors, the nutritionists, the pediatricians, the family practitioners, and people that are vested in the well-being of the children to make an effort to really decrease and rein in the amount of time that children are playing on their devices and on TV or on their iPhones. Also, it is very important to make healthy choices. I mean, it is very easy in a place like Northern Virginia to get food from fast food or a variety of fast food restaurants, to eat out a lot, or to order pizza and that kind of thing. And that basically really is a recipe for disaster because the children are getting bad nutrition, processed food, and they're getting basic calories that are unhealthy. That same amount of calories, if it comes from fruits, vegetables, greens, apples, tangerines, watermelon, pineapple, it's a lot better and it's a lot healthier. Milk, eggs, and the like need to be added to the diet, and basically things that are processed, made in a store, that come out of the box need to be removed and definitely limited in the household. So in general, even though the medical studies at this point show no benefit to the short interventions by pediatric physicians or other doctors on the issue of weight management between the age of 2 to 18, it stands to reason that more dedicated, more devoted time towards nutritional guidance and counseling could potentially be beneficial, especially if focus is made on cutting back on screen time and increasing physical activity. This is Dr. Kavian Milani checking in for Virginia Medical Updates. Thank you.